I'm Dr. Hendrik Roos, and I will be talking about the use of hypochlorous acid in the treatment of an irradiation ulcer of the lower eyelid. My name is Hendrik Roos. I'm a plastic surgeon by trade, but currently involved with a company called Trifectiv Pty Limited from Stellenbosch, South Africa. Stellenbosch is a small university town in the southern tip of South Africa, and therefore the southern tip of Africa. This is more or less where I'm talking to you from. It is the technology hub of South Africa. It's also a university town, and my alma mater, where I studied medicine. I'll be talking about radiation dermatitis. This refers to, of course, to inflammation of the skin originating from irradiation for cancer. It poses challenging problems, including skin inflammation and skin injury. Of course, the signs of acute radiation is well known to us. It includes erythema, pigmentation, dry desquamation, and wet desquamation. Radiation injury usually occurs within the first 4 weeks of therapy. Sometimes full-thickness ulceration occurs. The wound often presents with secondary infection, which may include multiple drug-resistant bacteria. The incidence of radiation dermatitis, what the journals tell us about this condition is that about 50% of patients will receive radiotherapy. This, of course, refers to cancer patients. Of these, 95% will develop some form of radiation injury, and 3% will develop necrosis and ulceration. The pathogenesis of ionizing radiation is through the creation of free radicals and reactive oxygen species, the activation of the inflammatory pathway. This leads to DNA and protein damage and damage to cell membranes of rapidly proliferating tissues. As mentioned, it's activation of the inflammatory pathway, which is at the center of inflammation of the skin in response to irradiation. Activation of the nuclear factor kappa B protein pathway activates the inflammation gene. Then there's a raised level of inflammatory cytokines and inflammation that results. With ulceration, of course, there's a further complication in that infection may take hold of the open wound, which almost always happens. And if this infection is in the form of biofilm, it adds a serious complication to an already difficult to treat situation. Biofilm further contributes to inflammation and delays healing. The current situation with radiation therapy is that there's no definitive treatment for radiation damage to the skin. But I want to propose that hypochlorous acid offers a solution to this problem. What is hypochlorous acid? The chemical formula of this molecule is HOCl. The Cl stands for chlorine, the O for oxygen, and the H for hydrogen. So it's a three-atom molecule, very small molecule that is normally made inside the white blood cells, and it is maintained in the white blood cells in the form of a vacuole. And when there is injury or infection or any reason for the white blood cells to become involved, usually the use of hypochlorous acid is centered to that application where the white blood cells become involved. Now, hypochlorous acid is a gas under normal situations in the white blood cell. When it is manufactured outside of the white blood cell, it is also in the form of a gas, but it is clustered within water molecules, making it possible to use this immune molecule in situations where there could be benefit. Medical grade hypochlorous acid refers to hypochlorous acid that is the only molecule that occurs in the water solution that it is presented in. It is early days still in the discovery of manufacturing methods to make this molecule in medical grade. Usually in the most common way of making hypochlorous acid involves the use of salt and an electrolysis process, and in these cases there's usually the presence of disinfection byproducts that does not make the solution suitable for medical use. However, I am talking to you about a medical grade hypochlorous acid here. It's presented in a white glass bottle. Glass is inert, limiting reaction with hypochlorous acid, which is a very reactive molecule, and it is in a white glass bottle to protect it from UV light, which is one of the dangers of hypochlorous acid from the environment. UV light destroys the molecule, so we try and protect it from UV light whenever possible in the form of container that we use. It's a multi-potential molecule. We present it in a strength of 380 milligrams per liter, that's 0.038%, at a pH of 5.4. This is of course an acidic pH, but a very low acidic pH, and in this strength and pH level it triggers rapid healing by combating infection, biofilm and inflammation. Furthermore, hypochlorous acid raises the skin oxygen level, and when it heals a wound there is very little scarring. The absence of scarring is almost described as similar to healing inside the uterus. We know that if, for example, there is corrective surgery done on a fetus inside the uterus, healing happens with very little scarring, and it is similar to this that the healing of hypochlorous acid is described. In the center of this picture is a triangle that depicts the three main functions of hypochlorous acid. Let's start with the left lower triangle here, infection. An infection is with planktonic bacteria. In this case, these are bacteria that can be detected and that a normal microscopy culture sensitivity profile can be asked for. These bacteria include the multiple drug-resistant bacteria, and it is described how hypochlorous acid kills all of these drug-sensitive and drug-resistant bacteria on contact. Biofilm is a more complicated infection. It's a more serious infection that usually occurs in an open wound, and we know that there's biofilm because of inflammation present in the wound. Biofilm is a strong stimulus for inflammation, but of course in radiation injury there is inflammation from the radiation itself, and if there's biofilm there would be an added component of the inflammatory response due to that. Biofilm consists of bacteria that adhere to a surface, and usually here in this case the wound, and if there's moisture involved then the bacteria adhere to each other, they adhere to the surface of the wound, they communicate with each other, secrete polysaccharide matrix, a slimy substance that gives them resistance to antibiotics and antiseptics, and they communicate with each other and become a dangerous organism that is, or a system of infection which is very difficult to deal with. However, hypochlorous acid is effective in eliminating biofilm, both the matrix and the bacteria. The third component of hypochlorous acid's function is the modulation of inflammation. This is well described in the medical literature. It is a multifaceted inflammation modulation system. Hypochlorous acid blocks the activation of nuclear factor kappa B proteins. It blocks the activation of the gene of inflammation and the release of inflammatory cytokines and the start of the inflammatory response. It also blocks the further downstream effects of inflammation, in this case the bradykinin response, which is responsible for wound exudate and a leakage of proteinous fluids into the wound. So a combination of biofilm control, infection control and inflammation control makes it possible to consider hypochlorous acid in the treatment of inflammatory irradiation injuries of the skin. Here's a list of multiple drug-resistant bacteria that have been proven to be susceptible to hypochlorous acid. And by no means an exhaustive list, but it gives you an idea of the efficacy of hypochlorous acid against these bacteria that range in this case from Mycobacterium tuberculosis in both multiple drug-resistant and sensitive forms, drug-resistant and sensitive Pseudomonas, Acetonitobacter CRE, OXA48 Klebsiella pneumonia, Candida parapsilosis, and MRSA. If an organism is a pathogen, hypochlorous acid destroys it. No resistance against its use has been described. Its effect is immediate on contact with pathogens, and I have to show you how this happens. These are bacillus, and you can see them explode in the presence of the hypochlorous acid molecule. So it's a ripping apart of the cell membrane. It's also described that it interferes with ATP production, and the effect is therefore different from antibiotics that needs to be ingested into pathogens and then metabolized. And then usually these ingested toxins for the bacteria have an effect on the cell membrane. In this case, it's a physical destruction. It's immediate and it's physical and very effective. A short word about biofilm. It is everywhere. Biofilm is the most common cause of infections in hospitals, at home. Some journals refer to it being the cause of more than 80%, some say even 90% of hospital infections. It's the most common cause of loss of joint replacements, dental implants, heart stents, intravenous catheters, intra-bladder catheters. All these infections have biofilm at its source. So it is highly susceptible to hypochlorous acid. Biofilm is the cause of inflammation on its own, a separate cause of inflammation, in addition to the inflammatory reaction from irradiation. If an open wound is contaminated with biofilm, it is so much more of a serious inflammatory problem that limits the healing of that wound. So the effect of hypochlorous acid on biofilm is the destruction of the polysaccharide matrix enveloping the biofilm organisms and the killing of the bacteria or viruses or fungi, whatever the cause of the biofilm is on its own. So controlling inflammation is of utmost importance. Controlling infection in both planktonic and biofilm form is of utmost importance. And the control of inflammation on top of that gives us an ideal product to consider for the treatment of irradiation skin ulcers. Let's look at this example of an irradiation ulcer. And in this case, it's the right lower eyelid of a 75-year-old female. She had incomplete excision of squamous cell carcinoma from the lower eyelid. And a radiation course was then planned of 60 gray in 30 fractions, commencing a month after the surgery. And the treatments were given 5 per week. At day 28, she was referred for treatment of a radiation ulcer on the right lower eyelid. Now, in this case, we see an ulcerated lesion on the lower eyelid that is inflamed with liquid secretions in that area, a wound exudate present. We can assume that there is biofilm infection because of the extensive inflammation that is involved. Biofilm is not visible with the eye, but you need a microscope to diagnose it. But it makes no difference to to us if we have hypochlorous acid present, because it treats the biofilm and any planktonic bacteria that might be present, and then suppresses the inflammation. And we can see over a period of a month, 30 days, resolution of the ulcer gradually happening, with here the only time that there was slight ectropion was when there was a scab present. But eventually all the healing is complete with no ectropion, which is significant. And this is, of course, of utmost importance in preserving function in the eye. If it was not possible to have healing with limited scarring, further surgery would have been indicated, with, of course, the usual trauma and financial implications. The other thing about radiation inflammation is that it is painful, and that patients complain about this, and they quite often request to terminate radiotherapy, which of course has its own implications. So in getting compliance, getting the patient to be compliant with the treatment, the use of hypochlorous acid as an anti-inflammatory agent reduces the pain significantly, usually within 24 hours. It is our experience that if there is any pain involved in an open wound, or there is a malodorous bacterial presence on the wound, that this usually is gone by the second day. It increases patients' compliance and allows them then to continue with the treatment. In this case, we see here there is a 68-year-old male with larynx carcinoma who has been developing ulcerous inflamed lesions in the area of his neck. And the painful situation that he was in prompted him to request that his radiation be discontinued. We started treating him with 3 times a day application of hypochlorous acid spray solution onto the wound area. In radiation injuries, it's quite often not possible to put dressings, and we find that the spray application works well, but you need to do it about 3 times a day. Patient gets a bottle to take home, and they do it at home. This relieves the pain, it reduces the inflammation, and healing commences. So we see here the process of healing that happened over a period of 14 days, allowing the patient to continue and finish his radiation therapy course. In this case, there is radiation dermatitis in an area of breast cancer treatment, a very common problem, very uncomfortable for the patients to endure. And we feel that the application of hypochlorous acid can be both used as a prophylaxis and, of course, as a treatment if the radiation is already present. When it's used as a prophylaxis, I would recommend that it started around 3 days before the treatment. Again, 3 times a day application, a spray application. And always when we use hypochlorous acid, you need to leave it to dry naturally on the wound. Don't dry it, don't try and rub it into an area. It's a molecule that does not take well to being mishandled. It also doesn't like to be mixed with other chemicals. So if you're going to use it on clean skin. Don't use it in combination with an antiseptic or with like, for example, silver impregnated dressings or iodine or alcohol or anything like that. It's a molecule that is highly sensitive to other chemicals. And of course, I mentioned it's sensitive to the sun. So use a bottle that is made from glass. It's inert, it doesn't react. It protects against UV radiation, and don't put other chemicals on the area where it's going to be used. In any case, it doesn't contain any metals. There's no contraindication to its use. And in areas where irradiation damage can be very uncomfortable, like the perineal area, it can be applied, but with a normal gauze swab, just gauze swabs saturated with the product and kept in place with a breathable dressing, a plaster dressing or just a crepe bandage, and replaced daily. In those cases, we also find healing very expedient. Now, from a summary point of view, hypochlorous acid benefits can be summarized as, first of all, it directly inhibits the nuclear factor kappa B pathway, which is the cause of inflammation in irradiation. So it directly opposes the inflammatory cause. And therefore, of course, the inflammation is the reason why further damage like ulceration can occur. The prime cause, the pathogenesis of tissue damage is hypoxia, as well as the release of free radicals and reactive oxygen species. So this hypoxia raises, because of the raised oxygen level that is detected in the subcutaneous tissue after application, and it's up to 72 hours after one application. There's a direct opposition to the anoxia, the hypoxia effect of radiation, and this further supports treating radiation wounds with hypochlorous acid. The anti-inflammatory aspect of hypochlorous acid has been described as strong as dexamethasone, but without any side effects. The product is in fact so safe that we have never recorded any side effects from its use. It can be sprayed in the eyes, it can be sprayed in the mouth, it doesn't have any stinging or burning effect. It has no cytotoxic effect on epithelial cells or other cells. It's a completely safe, natural product without any preservatives, making it a serious product to consider. And of course, the product has been published in the treatment of an ulcerating radiation ulcer, making it certainly a very serious product to consider. So thank you. That is the end of my talk. As mentioned, I'm Dr. Hendrik Roos from Trifectiv Plus in Stellenbosch, South Africa. I can be reached on the email labs@trifectiv.com.